When you're managing high blood pressure, you're rightfully focused on your prescription medication, your diet, and your exercise. That's excellent. But there's a massive blind spot in most people's treatment plans, the common over-the-counter medications you pick up without thinking. These easily accessible drugs, often used for colds, pain, or seasonal allergies, can directly counteract your prescription, raise your blood pressure dangerously, and even lead to heart failure. We're not talking about rare drugs. We're talking about 3 ubiquitous categories found in nearly every medicine cabinet. In this video, I'm going to break down the 3 most common over-the-counter medications you must avoid if you have hypertension, explaining exactly why they put your heart at risk. Good day, and welcome to Heart and Health. I'm Dr. Ed, a cardiologist. I've seen countless cases where a patient's pressure suddenly spikes, and the culprit turns out to be a simple cold medicine they took. The problem is drug interaction and direct physiological effects. Many over-the-counter, OTC, drugs contain ingredients that are vasoconstrictors. They narrow blood vessels, or that instruct your kidneys to retain salt and water. If you are already taking medication to widen those vessels and flush out salt, the OTC drug is effectively hitting the reverse switch. We'll examine the specific ingredients, discuss the severe risks, and provide safe alternatives you can look for the next time you have a headache or a stuffy nose. Hit the like button if this information is valuable to you, and ensure you're subscribed to our channel. Number 1. Decongestants. The first category you must treat with extreme caution is oral decongestants, particularly those used for stuffy noses, sinus pressure, and cold symptoms. The issue lies with active ingredients like pseudoephedrine, often found behind the counter, and phenylephrine, often found on the shelf. These ingredients are chemically designed to shrink the swollen blood vessels in your nasal passages, which is what relieves congestion. However, they are non-selective vasoconstrictors. This means they don't just shrink the vessels in your nose. They shrink the blood vessels throughout your entire body. If your arteries are already narrowed due to high blood pressure, this generalized constriction dramatically increases peripheral resistance, forcing your heart to pump harder against a much tighter system. This effect can cause a sudden, significant, and dangerous spike in blood pressure, potentially leading to a hypertensive crisis or even a stroke. This is especially dangerous if you are on multiple blood pressure medications, as the decongestant is fighting every drug you are taking to widen your arteries. It's like hitting the gas and the brake at the same time. It puts unnecessary and acute strain on your heart muscle. Instead of an oral decongestant, use a saline nasal spray or a topical nasal spray, like Afrin, for a maximum of 3 days. These topical sprays target the vessels only in your nose and minimize systemic absorption. Always choose a cold medication that is clearly labeled D-free or for high blood pressure patients. Read the labels carefully. Number 2. Non-steroidal anti-inflammatory drugs, NSAIDs. The second category is ubiquitous for pain relief, but extremely problematic for hypertension patients. Non-steroidal anti-inflammatory drugs, or NSAIDs. This includes common pain relievers like ibuprofen and naproxen. NSAIDs work by blocking certain enzymes that cause pain and inflammation, but in doing so, they directly interfere with your body's ability to regulate sodium and water. They can cause your kidneys to retain salt and fluid, increasing your total blood volume. This effect directly counters the work of diuretics and other blood pressure medications designed to flush out that fluid. Furthermore, NSAIDs can interfere with the function of antihypertensive medications like ACE inhibitors and beta blockers, making them less effective. Consistent, long-term use of NSAIDs has been strongly linked to worsening hypertension and even the onset of heart failure in high-risk patients. Even seemingly safe, everyday use for chronic pain can lead to a gradual, persistent rise in blood pressure that confounds your treatment plan. If you take an NSAID daily for arthritis or chronic pain, you are essentially ensuring your blood pressure stays artificially high, forcing your doctor to prescribe higher doses of your other medication, which increases your risk profile unnecessarily. For general aches and pain relief, the safest OTC alternative is acetaminophen, Tylenol. While acetaminophen is not without its risks, especially to the liver at high doses, it does not typically affect blood pressure or interfere with antihypertensive medications in the same way NSAIDs do. Always talk to your doctor about the safe dosage for consistent pain management. Number 3. Specific antacids and supplements. The final category involves specific antacids and seemingly harmless supplements that carry hidden risks due to high sodium or unique hormonal interactions. The first trap is antacids containing high sodium. Many effervescent or quick-dissolving antacids contain significant amounts of sodium bicarbonate, baking soda, or sodium carbonate. While they relieve heartburn quickly, the large, rapid sodium load forces fluid retention, temporarily spiking blood pressure. Always check the label for sodium content on antacids, particularly those that fizz. Look for calcium carbonate-based alternatives. The second, more subtle trap is the herb licorice root. Licorice is often found in natural remedies for digestion, soothing teas, or certain supplements. The danger lies in a compound called glycyrrhizin, which mimics the hormone aldosterone. Aldosterone signals the kidneys to increase salt retention and potassium loss. This double whammy, retaining sodium while losing the essential mineral that helps fight sodium, can cause blood pressure to rise significantly, even in people without prior hypertension. This is particularly tricky because it's perceived as natural. If you take herbal supplements, look for DGL, deglycyrrhizinated licorice, which has had the harmful compound removed. If the label doesn't specify DGL, avoid it completely. So, let's review the 3 critical OTC categories you must avoid or use with extreme caution. 1. Decongestants due to generalized vascular constriction. 2. NSAIDs, ibuprofen/naproxen, due to fluid and salt retention and drug interaction. And 3. Antacids/supplements containing high sodium or licorice root. Your prevention blueprint requires you to be an active reader of labels. Don't assume an OTC drug is safe just because it's easily available. Always check the ingredients list for decongestant names and look for the sodium content. When in doubt, call your pharmacist or doctor. Remember, consistency in your treatment means watching everything that goes into your body, not just your prescription. If you found this video empowering, please consider subscribing to Heart and Health. That button helps us reach more people who need this vital information. I'd love to hear from you. Which of these 3 categories have you unknowingly used recently? Let me know in the comments below. Thank you so much for watching, and as always, take care of your heart.